Today we're honored to welcome Jeff Gross to the show today. I'm very happy to have him on. He is a regenerative medicine expert. He talks so much about stem cells, exosomes, all these different things that are really interesting and can be very beneficial to overall health and wellness. And if we utilize these tools and learn about them, we can amplify our overall health and longevity and overall well-being. And we're going to get into peptides as well. So very interesting topic as well. And again, we can use these tools to amplify our overall wellness. And again, very excited to have him on the show. How are you doing today, man?
I'm doing great. Thanks for having me.
Absolutely. I'm very curious to hear your story, how you got into longevity, regenerative medicine, everything you're doing to be of service today.
Yeah, I mean, I'm a neurosurgeon by training. I have a fellowship in spinal neurosurgery. I did a lot of care of neck and back problems, disc issues, pinched nerves, all that for decades. But I noticed that nothing was changing in my field. You know, we'd go to the annual meetings and, you know, the same old stuff we've been doing for decades just sort of, it became distasteful. And I saw patients saying, hey, we don't want surgery if we don't have to have it. What about other options? You know, we've tried everything. What about stem cells? So they would ask me that. And luckily I have some undergraduate background in molecular biology. So I said, you know, let me go to some different conferences. So I started going to stem cell conferences about 8 years ago. I re-educated, I updated, I put down the Kool-Aid, and I said, this is a new tool we can add. We have options, and we should make these available. But it's blossomed into so much more. It's almost all I do now is some type of discussion of options with people for stem cells or exosomes or peptides, and it's been an amazing and re-energization of my medical practice.
Awesome. Thanks for sharing that. So it sounds like you're looking at the conventional medicine, but then like there has to be more options. Like what are the other options that you came across regenerative medicine? Is that right?
That's right.
Awesome. So can you explain to people what regenerative medicine is as a whole and how we can actually kind of utilize it in our own lives?
So regenerative medicine is a strategy. It's a strategy by tapping back into what we've learned about how we as humans are created, you know, as a fetus in the womb, and how we repair and heal better as a young person and less as an older person, and what happens to that repair process because it's still in our genes. And why can't our cells do it as well as they used to? So we tap into that youthful healing cascade of cellular activity and growth factors and proteins and peptides, and we re-stimulate and remind our cells how to do what they should be doing when and how they used to do it when we were younger. So it's sort of a hack into tapping back into and reminding our system how to do it.
Got it. So kind of like amplifying our regenerative capacity. Is that right?
Yeah, back like when we were younger, because you know when you're a kid and you hurt yourself, you heal like quickly, right? It's not a big deal, and but when you're older and you hurt yourself, it takes longer to heal, or sometimes it doesn't heal at all. So heal is a model, though, for also maintenance and, you know, the slowing or preventing degeneration.
Yeah, it makes sense because like we come up against so many different things in our lives and all these stress, oxidative stress, all these different things.
Right.
And it's good to, you know, amplify our capacity to heal these things. So it makes a lot of sense.
Agreed.
So within regenerative medicine, there's of course stem cells. Do you want to explain what that is within our own bodies and like what is utilized as therapy too?
Yeah, absolutely. So, you know, most people have heard this phrase stem cells and they sound exciting, but what are they really? And the stem cells are the basic cell from which all other cells stem. So when you're a fertilized egg inside your mother's womb, you're a single, very powerful stem cell. You're going to create a person out of that. Those cells divide into, you know, a fetus, an embryo and a fetus, and the fetus has, you know, powerful stem cells, not as powerful as that original stem cell. And then those cells divide, and when you're born, you have what are called multipotent stem cells. They're pretty powerful, but they're not as powerful as the ones that create a human or build a limb or create a liver. So these cells are maintained in our body. Most of them are in the bone marrow, but some are in fat and along the blood vessels and other places. And these stem cells are used when we need them to repair, to heal, if you're injured. They are there also to help replace tissue. A lot of skin is renewed, a lot of liver cells, other things. And with time and exposure to our world, full of, as you said, oxidative stresses, free radical damage, electromagnetic fields, poor diet, toxins, pesticides, what have you. All these things cause our cells to not work as well, including our stem cells. So they can't do the job they used to do. But we can tap back into that youthful source and use them as a therapeutic endeavor to help restore some healing capacity where we need it in a strategic way, like you're trying to heal a joint injury or you've got a brain injury or something, and we can use stem cells to help signal to our cells how to behave better and more youthfully and less inflamed.
That makes sense. And to my understanding, exosomes really help stem cells work better, like in synergy. Is that right?
Well, some people might say that, but truly stem cells aren't doing the work. Stem cells are delivering the signal, and the signal is to our cells. The signal comes in two forms. It comes through the release of growth factors, peptides, and proteins, and those are all in the same family. And some of those work at a distant site in the body, and some of them work at a close site. And they are taken in by neighbor cells, or they bind a receptor on the surface of a neighbor cell and cause some influence or encouragement for that cell to behave in the way that we want it to. The other message is through these small packets of cellular or biomolecular information in the form of microRNAs and other peptides that require membrane encapsulation. So a cell gives off these small packets with a little outbubbling of a little bit of a membrane, and these are called extracellular vesicles. And a stem cell can give off 1,000 of these a day, and they're about 1/1000th the size. They're measured in nanometers across, so some people call them nanoparticles or nanomedicine. And these, for short, we call them exosomes, because exo meaning out of, somes the body of the cell. So they're out of the body of the cell, they get released, and then they're taken in by neighboring cells. And that is how a stem cell works. So you actually don't need the stem cells at all as long as you have the exosomes and the growth factors, the signal. In fact, these days, we are now not using the cells very often at all because they only last a day or two in your body. But the benefits last much longer. So we tap right into the cell signal because it's less expensive and it travels through tissue better, crosses the blood-brain barrier, gets into the brain and more. So we like the exosome, or what we call the secretome, or the signal from the stem cells, more than we like the stem cells.
Very interesting. So in terms of stem cells, I know there's different types of those. You want to get into that and how those can benefit everyone?
That's a great question, because we use this phrase stem cells, but there are so many different types, like you said. When we talk about stem cells, we're typically talking about the basic one that we have in our body called the MSC, or the mesenchymal stromal cell, or the mesenchymal or medicinal signaling cell is the other way we talk about them. Because it speaks to what they do. They signal our cells. And those are very common. They are multipotent, so they can't create a new human, they can't create a limb, but they can help replace tissue and encourage our body to heal better and to behave in a less inflamed way, which means the cells are more optimal to do their jobs. If you go backwards in the embryo, you have what's called a pluripotent cell. And Dr. Yamanaka, who won a Nobel Prize for identifying 4 different small growth factors that can induce, where you take a mesenchymal signaling cell and you move it backwards to become a more powerful cell, you induce it, and those are called induced pluripotent stem cells, or iPSCs. They're more powerful. We're learning how to use them. They're hot in research right now. We're not really using them therapeutically in the clinics, except a couple academic institutions looking at very specific subsets of those for cancer treatments. And then if you go even backwards further, you can cause an omnipotent stem cell. I don't think there's any current work in that. And then there are embryonic stem cells that we don't use because they can't be ethically sourced, right? Because we don't want to hurt any baby in development or do anything morally wrong. And then there are tissue-specific stem cells. You take these MSCs, you can induce them down the neurologic pathway or the skin pathway or the liver pathway. And we're looking more and more about these more specific ones because they release more specific exosomes for a specific desired outcome. Like if you have thinning hair and you want to grow more hair, well, we should have some of the hair follicle, the skin stem cell exosomes to do that work. So we're getting more granular in that way.
Got it. Makes sense.
I should mention, Anthony, one more, and there's a very small subset of stem cells, of MSCs, called Muse cells. And they are a little more powerful, not quite pluripotent, and they're about 1% of stem cells, and they are now becoming a little more popular because they're more potent. So you'll be seeing these come on, MUSE for Muse, and you'll be reading about these if you haven't already, standing for multilineage, undifferentiated, stress-enduring stem cell. Don't worry about that. There's no quiz on this later, but it's a Muse cell, Muse stem cell.
Very interesting. So when it comes to exosomes, what are those exactly? Like, what role do those play in our bodies?
They are cell signals. They take let's say we have some cells in our knee, and our knee is a little older, it's a little inflamed, you've got a little degeneration, some pain, loss of cartilage, some tears. The cells that make the cartilage in the bone edge in the old growth plate, they've been inflamed over the years, and they just can't make cartilage anymore. They can't maintain that joint. They can't heal that joint. Well, if we can use these stem cell-derived exosomes to put back in there, we can re-stimulate those cells to stop goofing around, get off the couch, and make some cartilage and help restore that joint. And it does that by suppressing the inflammatory pathways in those cells, flipping our cells into anti-inflammatory mode, where the cell can go back to what it's supposed to be doing. Because really, cells have two main sets of pathways going on. You're either inflamed and getting junked up and degenerated, or you're uninflamed, where you can be optimally functioning.
Got it. Makes sense. And when it comes to the sourcing of stem cells, like, what is the importance of that, and where do those actually come from?
It's a great question. So when our clinic vets where we get them, and this applies both to stem cells and to exosomes, so we can go across the board, is we only want United States sources of people who are donated, has to be donated tissue at the time of a healthy baby birth. So the mother is, congratulations, here's your baby, and we were going to throw away the placenta, the umbilical cord, the amniotic fluid, but can you donate it because we might be able to put it to good use? So this is done through the American Tissue Bank, donor services, the same place you get a kidney or anything else, and it's done in an ethical way. These mothers that we choose from a pool have not been vaccinated for COVID because we don't know what that variable brings. They have to be screened in the first trimester. They have to take prenatal vitamins. They cannot smoke, drink, or use drugs, and they can only have one romantic partner. They are screened again at the time of birth, and then the materials go right on ice to an FDA-registered lab that meets all the requirements and documentation, tissue handling, cleanliness, etc. And this is a highly regulated and audited process where they get site visits and all that. And these tissues are quarantined for 2 weeks. They're tested and cultured, make sure there's no endotoxin or bacterial contamination, because these can only come from C-section. C-section is a sterile procedure. A vaginal birth is considered a non-sterile procedure, so they have to be C-section. And then the tissues are tested for exosome count, for protein, which is the growth factor quantity, concentration, and they have to meet certain criteria for them to become available to us. And if they meet all the right criteria, then we purchase them and use them clinically.
Got it. What role does the placenta play in terms of stem cells?
The placenta has a source of stem cells. Those cells go through the umbilical cord. The umbilical cord is more rich in stem cells in a gel-like material called Wharton's jelly. But stem cells are also floating around in the amniotic fluid. But what's really robust is the exosomes that are floating around in the amniotic fluid and the growth factors. This is the baby making factory. Think about, Anthony, a sci-fi movie where the hero is injured and they put him in a vat of goo, like going back into the womb, where he's getting all growth factors and exosomes. I mean, that's what we envision here. That's kind of the model.
Yeah. That's Neo right there.
Yeah, it is.
So, what are some natural strategies that could boost stem cells in our own bodies in terms of lifestyle? Do you come across anything like that?
Totally. Yeah, you can boost your own stem cell activity by particularly hormetic activities, including fasting. These are things that have a slight stress on the cells to build resilience. So fasting, hot sauna, and I'm talking real sauna, not infrared, cold plunge, high intensity exercise, to failure, maybe going into low oxygen situations cautiously. Those are the kind of things we see that stimulate stem cell activity. You can also, there are also supplements that might stimulate the release of stem cells and encourage stem cell activity, use of glutathione, which is hard to get into your body, but things like that can do that.
Awesome. So from a nutritive standpoint, is there anything like we can eat from that level? Like anything that comes to mind?
100%. So, for ages, bone marrow is known to be super healthy. Why? It's rich in stem cells and exosomes. So bone marrow is a delicacy, and bone broth has plenty of exosomes in it. The cells probably don't survive the boiling, but the exosomes may. So why does your grandmother make you chicken soup when you're sick? In most cultures, it's because the exosomes from the bone marrow of the chicken stock, right, are helping your immune system. So you've got the bone marrow, the bone broth. You've got colostrum has exosomes in it. The cells don't survive or get into your system. They don't survive the gastrointestinal tract, but you get the exosomes. Again, another reason why we think exosomes are probably really better in doing the work of the cells anyway. Milk, and especially whole milk, and then certain plants make exosomes, and that's how they deliver their phytonutrients. And if I could take a slight diversion here, it's very interesting because if you say, hey, I'd like to take a supplement of a phytonutrient, I'm going to take some resveratrol. I hear that's really good for anti-aging. I'm going to take some resveratrol. And you go to the store, you get a bottle of resveratrol capsules, and those capsules have this, granular powder, whatever. That is a highly processed thing where they probably took red grapes and they extracted out, the cells from the grapes, then the exosomes, and they broke up the exosomes and just have the resveratrol molecule. So here's a problem: you eat that, a lot of it gets digested in your stomach, your gastrointestinal tract. Then some gets into your bloodstream, but it's bouncing around your bloodstream. It's not going to go into the cell necessarily. So very little of it actually gets to your body. But if you are a vitamin company that puts that in a liposome, which is sort of a fatty membrane, you get better absorption into your cells. So this liposome is a synthetic exosome. Well, shoot, nature's already figured this out. Plants already produce resveratrol and exosomes. All you got to do is get those. So there is a single product on the market that we've been behind called Longevex, and these are organic Italian fruit exosomes extracted. So they're natural, exosomal phytonutrients. They have all the B vitamins except B12 because that's not exosomal. They have, glutathione, resveratrol, quercetin, fisetin, and other components, and they deliver to your cells at 700 to 4,500 times what you get from a regular, pill you might get at your vitamin store. So check that out.
Got it. Sounds like a lot of these things they may not get absorbed as well as we think. Is that right?
True. Or they get into your bloodstream and they're bouncing around. You go to the lab, you get a vitamin B6 level, and that's measuring what's in your bloodstream, not what's in your cell where you need it. So we probably aren't measuring right. And you need these in the cells. They're not doing anything outside the cell.
Yeah. That bone broth is real special for sure.
Yeah, agreed.
You mentioned colostrum. Can you talk about what that is and how people can utilize that?
Yeah, same thing. So colostrum is the early mother's milk. When you buy it on the market, you're really probably getting it from cow. You know, the cow has a calf born, and then that early milk is colostrum. And these days it's powdered. You get it and you mix it into a smoothie or something, and it's rich in exosomes. And those exosomes, get into your system to some extent. Not as good as the plant exosomes. They have a much higher bioavailability.
Got it. Are you familiar with the compound phycocyanin?
I've heard of it. It sounds like it might be on my list of phytonutrients.
Yeah, it's so like essentially like the Earth was apparently in this blue hue way back,
Yep.
right? And it's
Yep.
like this compound phycocyanin that's now found in like spirulina
Yep.
and I believe blue-green algae, perhaps cacao, and it's
Yep.
apparently been shown to increase our stem cell proliferation and
Yep.
increase the overall amount in our body. So I think that's really interesting.
Yes. So there are supplements on there to help you release your own stem cells. I think that's one of the major ingredients. But you brought up spirulina, which brings out spermidine, which is a really great supplement. But again, spermidine is made by plants in exosomes, and the spermidine supplements on the market are non-exosomal. So if you really want to get granular and get some delivery of spermidine, we have to get an exosomal source. We are working on that. We don't have it yet.
And with plant-based exosomes, like how does that fit into this exactly?
Yeah, I mean the challenge is extracting the exosomes. It's very labor intensive. So if you can extract the exosomes, you're getting a much better and high concentration delivery, because you couldn't eat enough spirulina to give your cells the kind of spermidine we really want them to have. So that's why we really have to come out with an exosomal delivery where your cells can just get a ton of spermidine.
Yeah, like with the exosomes and like all these nutrients we're talking about, it's like also it's an overall approach, right? It's like these things work in synergy, and it's like these things when you utilize them in our own lives, it's more so for like increasing our overall regenerative capacity, right? Because again, like as we mentioned before, there's so much stresses and things that we come up against.
Yeah.
But once we start to stack the conditions in our favor, I feel like that's when we start to feel better as well.
100%. I agree with that.
And what is stem cell proliferation exactly? Like, what does that mean?
Well, we have these banks of stem cells in our body, and to get them into our system, they have to be encouraged to be released out into the bloodstream. So proliferation usually means cells dividing. So some stem cells can divide as well and duplicate, but you don't want it when they've divided many times, because they're less effective. Their telomeres are, scraggly and they're not as good. They get inflamed. We want the least divided ones, so we like the stem cell release activators. So like you said, some of the algae phytonutrients have been shown to do that.
So getting them exactly at where they need to go.
Well, they find their way. Stem cells hone towards areas of inflammation. But to get them released out in the system and deployed, it's like we need to send the army, over to a different country. So we have to put the whole army there. Then they'll figure out where they need to go do, what they need to do.
Right. Are you familiar with V cells at all?
Yes.
Want to talk about that? How we
Yeah.
can use those?
This taps into, we'll call it, the quantum states of cells, use of vibration, light, sound, other wave energies that can help stimulate cellular activity. This is a sort of developing, evolving field where you have to do it just right. So if you give energies, it could be infrared light, it could be different kinds of light, to cells, has to be just the right energy. You can get better activity. You could also hurt the cells, give them too much energy or too little energy. So it has to be dialed in like a radio station before the era of digital radios, right? So you have to dial it in just right. And we're learning more and more about this, and it has to do with the quantum state of the molecules in the cell.
It's like very small embryonic like stem cells, right? And they're like a smaller form of it. Is it like more effective than regular stem cells? Like, what's your take on that?
Again, this is evolving. There's literature that suggests that, and it's probably a little early from my side. I have not adopted those therapies. I do have colleagues that use various forms of light to stimulate cells into V cells, but it's evolving. It's not something I've adopted.
Got it. And is there anything that you're kind of excited about in terms of regenerative medicine that is upcoming? Anything on your mind?
Yeah, I mean, we've got access to very specific things here in the clinic now. We've got natural killer cell exosomes that really can be used as a strategic adjunct to help people with cancer. We've got access to tissue-specific exosomes for skin and hair growth. We're working on access to neurological stem cell exosomes. We are sourcing Muse cells, and soon we'll have Muse cell exosomes. And then you and I talked offline before we started that the world of therapeutic signaling peptides is humongous right now, and we probably are doing more and more of that and stacking them with different regenerative therapies. They go hand in hand. So these are all under the envelope of, biologics or regenerative biologics.
That's right. So let's see the peptides. So what are those exactly, and like what role do those play in our bodies?
So peptides are essentially small proteins. So when you look at a protein, it's a string of particularly ordered amino acids, and there are at least 20 amino acids used by our body, probably others that are slightly modified in addition, and some are essential. We don't make them all, and if you do protein supplementation for workouts and stuff, you have to get a supplement that has the essential amino acids from your diet. So amino acids are strung together and make a protein. Some of them are hundreds of amino acids long. The shorter ones, usually about 20 amino acids and less, are called oligopeptides. Oligo means few, so few amino acids. And these, for short, are called peptides or therapeutic peptides. And they have signaling capability in the body, can be used to enhance strategically certain cellular goals and desires and pathways. For example, if you want to help heal a musculoskeletal structure, you might take something called BPC-157, which is a 15 amino acid peptide, and that stands for Body Protection Compound 157. And you might take TB500, thymosin beta 500, so that is from the thymus gland. The BPC is actually naturally occurring. It's found in gastric juice. And these together can accelerate a healing in the musculoskeletal realm and other areas. There are many other peptides, like that's just scratching the surface, but that's a common one. The most common peptide is probably insulin or a GLP medication, like semaglutide, tirzepatide, retatrutide, things like that.
Awesome. So when it comes to these, I would imagine sourcing is important as well.
Yeah, you got to do your homework. So when we source peptides, we want to find a source that has the peptide has been tested for purity. So we want at least 99% pure. And then it's also been tested for contaminants, heavy metals, etc., endotoxins, so it doesn't have bacterial involvement. And that typically gets it to a place where I'm comfortable using it on myself, my family, and other people. So you want to get that. If you're buying these online, you want to look for that. I wouldn't buy them direct from a Chinese source, but a lot of them do. The raw ingredients come from China, but the compounding pharmacies and the labs that import them have to test them to maintain their registrations. So they do the purity, they do the contaminant, and they should be sharing that transparently. So usually it's online or it comes with the product, and that's a lab that you have more trust for.
Right. So there's like these research companies, or they may not be the best idea to get them from.
They can be just as good as the other sources as long as they transparently share the testing and contaminant data. They're not a registered pharmacy, but that doesn't mean they can't offer something that meets the criteria for a pharmacy just without the regulatory piece.
Very interesting. So when it comes to like the methods of how they're used, like is it injection, is it oral form, like how does that work?
Yeah, listen, there are oral options for peptides. Largely, they have probably only a couple percent of the bioavailability as a subcutaneous injection, with the exception of perhaps copper peptide that's used topically on the skin, also called GHKCU, and the exception of BPC 157 for gastrointestinal purposes, which you can take orally. Other than that, you're messing around if you're not injecting them.
That makes sense. What types of injections are typically utilized for these things?
Yeah, just a little subcutaneous, like insulin syringe, a Botox needle, usually in the belly, and you can barely feel it.
Got it. And so, if people are wanting to get into peptides, like what are some typical uses that you see? Like, is it for injuries? Is it for overall longevity? Like, I'm sure there's a variety of things.
Yeah, I mean, injuries is number one. I come from a background of spine and joints, so I treat a lot of people with joint problems. We use regenerative medicine and we stack with peptides. So we commonly use the BPC 157 TB 500 combo, sometimes referred to, at least in part, as the Wolverine combo, because the Wolverine character from the X-Men can heal himself. We often will add Cartilax to that, which is a cartilage anabolic. It helps grow cartilage. For healing mitochondrial problems, we might tap into one called SS31 and or one called MOTS-C, both naturally occurring in the body. You just need strategic use. A lot of people with spike protein damage from the COVID vaccine have been shown to have some benefits from use of this mitochondrial repair. We also use, for aesthetic purposes, the copper peptide. For the brain, we might use something called KPV for brain inflammation, and there are others. There's for nerve repair, ARA290. We use some to help stimulate muscle mass development and growth that help release growth hormone. These are called samorelin, hexamorelin, tesamorelin, ipamorelin, and they can be matched with something called CJC, which helps extend the life of those in the body. We could do a whole show on peptides and what's out there for brain recovery, for metabolism, for sugar. For longevity, we're using a lot of bioregulators, thymosin alpha-1, which is also good for immune stimulation, immune activity. We use epitalon, which stimulates the pineal gland to release more melatonin, which is a repair. It's not just for going to sleep, it's a repair peptide, a repair hormone, and so many others. So this is a real blossoming area right now.
Awesome. You ever see how it can potentially play a role in healing the gut?
Yeah, the BPC 157 will be a go-to. To start with, we look at people's microbiome and study their biome, and maybe they need some specific probiotics and peptides and to help that.
Awesome. To go back to stem cells a little bit, like, do you see any difference between maybe a surgical options or stem cells for injuries? Like, is there indication and what we can look for in terms of that?
Oh, absolutely. I mean, that's probably the most common application in my clinic is someone with joint degeneration, loss of cartilage, bone on bone, trying to avoid joint surgery. All that's a process of what's called osteoarthritis, or some doctors dumb it down to the word arthritis, which doesn't really tell the story. And these are people we see. We do some MRIs, some high-quality MRIs. I order off the secret menu. We know how to dial that in on the MRIs, and we target the bone edge. In Europe, they've proven and have published significant medical evidence with 15-year follow-up demonstrating if you put the regenerative biologics in the bone edge, you re-stimulate the cartilage-forming cells and turn back on that growth plate, turn back on the factory. And we have examples, in fact, some of these are on our social media, where we've injected the bone edge with exosomes, and a year later, there's 25% or more thickening of the cartilage.
Wow.
Yep.
To my understanding, these can also be derived from fat or bone stem cells?
Yeah, I mean, there are doctors that will take stem cells from your own fat or from bone, or bone marrow. Those are other sources. I don't like to use anything but the youngest source. It's the most active source. Plus, We don't have the hassle of having to harvest from your bone marrow or harvest from your fat. So we have, I think, better off-the-shelf options. It saves in time, money, and processing.
Awesome. From a legal standpoint, I understand that these are kind of I don't know, I guess not as accessible as you would hope, unfortunately.
I don't know that that's the case. I mean, health insurance doesn't want to pay for some of these things. So if that's what you mean, then I get it. But, if you look at the very lowest level of regenerative biology or regenerative medicine, it's called PRP, or platelet-rich plasma, where they draw from your own blood and they take the growth factors out of the platelet layer, the plasma platelet layer. That's not approved for marketing claims by the FDA, but now insurance companies figured out it's cheaper than surgery, so they started paying for it. So I think it's coming where insurance companies will pay for this stuff, but it's accessible. There are clinics everywhere. Now, you don't hear about them all the time because your regular traditional doctor health system, in the sick care system, they're not going to tell you about it necessarily. Maybe there are a few that will. You have to find a doctor like me that put down the Kool-Aid and opened his mind to see what options we have to offer people under the informed consent doctrine. So I want to be comprehensive when we do that. Surgery, injections, regenerative medicine, peptides, I mean, all these things should be discussed for the betterment of the patient's best interest always. So they're available. We can't advertise. The FDA has not approved marketing claims, so you don't find ads on Google. You don't find ads on Facebook. They shut us down immediately.
Right. Wasn't the FDA trying to get them classified as a drug?
They are. The FDA just said these are drugs because Big Pharma wants to control it, and they can only control it if it's in a drug approval pathway. So that's fine. They can call them whatever they want. We can't make any marketing claims, and everything I'm saying here today is for educational purposes. I can show people medical evidence, publications. I can show them results we've had. I can't make a claim that I can cure or treat them any specific disease or condition, which, I've been a surgeon. I've never guaranteed anything anyway, so nothing's really changed, So there are myths out there that these things are illegal. They're not. But if you make a marketing claim, you're non-compliant with that, agency code.
Makes sense. Do you utilize PRP at all?
No, I have more powerful tools. There's nothing wrong with PRP. I have better tools that we can often do with one injection. PRP is often 3 injections. I don't have the hassle of having to draw blood and spinning it down and all that. So we have really, I think, better tools than that and make it more efficient.
Yeah. So what other types of regenerative medicine that are utilized? Because I know there's so many different things, but is there anything that comes to mind that other people should know about?
I think I've covered, 99% of it here today already. We've got different types of stem cells. You've got exosomes from the different types. You've got growth factors. You've got PRP. You've got peptides. There are some other things in the pipeline, different types of growth factors or nanomedicines. They fall within these headings. So if you've listened to this podcast, you almost have a PhD in regenerative biology.
Yeah. What about prolotherapy? Is that something that's worth doing at all?
Could be. Prolotherapy is injecting sometimes sugary or salt substances in tendons or ligament areas to help them form a little scar tissue and tighten up, to stabilize something. It causes an inflammatory reaction. So there is some regenerative biology involved in that. And there's nothing wrong with it. I know people that do it for certain issues. It can be helpful.
Awesome. How can these tools be utilized for our overall immune system, our overall vitality in a sense?
Well, you're making a point here. I think the point is that the better your immune system and its adaptability, the better longevity you'll have. So that's your vitality there. And the ways to do that would be regenerative medicine, hormesis, fasting, things like that. A 3-day fast is fantastic. Anything that stimulates your natural killer cell function, like glutathione, high intensity exercise. There are some other supplements that can be used to help stimulate the immune functioning. Eating of the earth, great diet, anti-inflammatory lifestyle, staying away from things that inflame you, from stress all the way to, pesticides and seed oils and things like that.
Yeah, because when it's being in the modern world today, it's like there's so many different things that diminish our regenerative capacity, right? It's like
Right.
it makes it very hard to be healthy, and that's why
I
these
agree.
tools are so important to know about and kind of
Yeah.
utilize, right? Because like the more we stack the conditions in our favor in terms of wellness, it's just easier to
Yeah.
feel well and be optimized.
100%.
Yeah, I mean, like speaking of that, like, do you have any uh, thoughts on like the environmental factors that could be diminishing our capacity overall?
Oh yeah, I mean we're looking close at electromagnetic waves, 5G and all that. We've started doing things at home to help mitigate that. We have EMF blockers on our phones and computers now, and we're negotiating whether or not we're going to turn our Wi-Fi off in the house at night, and we have a grounding mattress pad. So yeah, I mean I would mitigate that as much as you can. That taps back into our conversation on wave technologies and how they affect the cells. When you were asking me about V cells, and then we're trying to eat more organically and more fruits and vegetables. We are taking exosome supplements at home. Again, there's only one on the market. The high intensity exercise, maintaining the core, the transverse abdominis, breathing exercises, yoga, mindfulness, reducing mental stress, and then we use a lot of peptides and things to suppress inflammation. So, and I do IV exosomes 4 times a year just to help mitigate that. We also do other things. We do bioidentical hormone replacement to optimize inflammation profiles in people. As you lose your hormones, your cells inflame more. So we're trying to flip that.
Yeah, get the Ethernet, man.
Yep.
And exercise is so important because it really, like, it's like a internal fountain of youth, right? Making all these hormones and all these things that we talk about,
Yep.
we actually require a movement and
Yep.
intensity to actually cultivate these things, as you mentioned.
I couldn't agree more. That is key.
Yeah. Also, you mentioned EMFs a few times. Do you want to describe what that is and maybe how we can mitigate that in our own lives?
Yeah, electromagnetic fields are all around us, right? Everything electric gives off an electric field, and we know that if you live in close proximity to, for example, a high power line, your chance of cancer goes way up. So these are bad waves or bad frequencies. So you can find shielding and blockers for your home, for all the electric equipment that you use, and things like that. There are people that wear necklaces also that have an EMF blocker to help protect the field around them. So that's what I'm talking about. Anyone watching, I know you might be listening to this, but here's the back of my cell phone. I've got a EMF absorbing device. It sort of sucks up the EMFs off of my phone. And I try not to use my phone next to my ear often. So if I'm doing a call, I'm on speaker or something like that. But of course, we use the phone for so many more things than we invent a phone these days. But
Yeah, very interesting. What other strategies that we can actually use to actually mitigate that? Because I understand it's very important.
Yeah, well, the EMF blockers, going out in nature and getting away from cities for a minute. You can, other anti-inflammatory activities like we discussed can help mitigate some of the inflammatory stresses in the body and in the cells. Again, this comes down to taking care of your cells and really taking care of your mitochondria. At the end of the day, our cells serve the mitochondria. And if you take care of your mitochondria, you take care of your cells. If you take care of your cells, you take care of yourself.
Yeah, I mean, it's all about the mitochondria, right? It's so important to take care of that. And, having all these things work together in synergy, I feel like is how we create real health overall for sure.
Yeah, I agree.
All right, Dr. Gross, this has been awesome. I really appreciate you coming on the show today, man, and sharing your story with us, all your insights. And just learning about these tools overall can be very beneficial for people, right? Because we may come down with something at some point, and just knowing what we can do and know that there's other options, right? You mentioned that
Yeah.
it's like just having options of what's possible and utilizing natural strategies to increase our overall wellness as maintenance. That's so important too. So again, it's been an honor and it's been really fun
Me too. Thanks so much.
for sure. So if people want to get connected with you, all your amazing work, where do we find you?
Our brand is Recelebrate because we're celebrating the renewal of your cells. And if you look up Recelebrate, it's RECELLEBRATE. So our website, recelebrate.com, or Instagram at Recelebrate. We're also on all the other social channels with the same name. And as far as I know, we're the only people using that word spelled that way.
Awesome. Thank you.
Thank you.